I'm Dr. Lisa Ayuchi. I am a general surgeon and breast surgeon, board certified in general surgery, and I work here at the Premier Surgical Network. A pilonidal cyst is a cyst within the sacral region or the upper part of someone's buttock. It's technically called the gluteal cleft. This area is an area of a lot of hair follicles, and sometimes those follicles can become infected and form a cyst. Sometimes this is something that happens at birth, that people are predisposed to having these, and other times it happens throughout someone's life and they just have never had an active infection and didn't know that it was even there. A patient who has a pilonidal cyst may or may not know that they even have it, but something to look out for would be redness or swelling from right above the buttock area. Another thing that could happen if it's actively infected is drainage of fluid from that area. And it's something that needs to be seen by a medical professional and evaluated and possibly treated with antibiotics or maybe even drainage of that area. The treatment options for a pilonidal cyst include just medical conservative management of antibiotics and possible drainage of the infection. But ultimately, if a patient is having these symptoms recur over time, the only true treatment is to fully excise that tissue surgically. It is a larger procedure and it requires excision of all of that tissue just above the buttock and reconstruction of it with a skin flap. The recovery can be a little difficult because of the area of excision. We require that the patient does not do direct sitting onto that site until it completely heals. So it can be a very taxing recovery, but ultimately once the patient has recovered from that surgery, the hope is that they won't have to deal with recurrent infections in that area any longer. If someone does have a concern of a pilonidal cyst and they'd like to discuss their options, they can call and make an appointment with one of our surgeons here, and we can discuss the options that that patient has specifically.